Relatives of patients who died when this hospital's oxygen supply ran out are overcome with grief.
My boy had recovered 75%. If oxygen was available, he would have survived. But without oxygen last night, he died.
Others vent their anger at hospital staff in the state of Karnataka. One man said his brother called him at midnight asking for help.
We got a call at midnight that he's not getting his oxygen supply. He got married just 2 months ago. Now who will look after his family?
Karnataka is one of India's richest states, but also one of the worst affected. Few places in the country have been spared by the second wave of the virus. The capital, New Delhi, set up its first oxygen generation plant after more than 50 patients died when their supply ran out.
When we are completely dependent on supply chains and cylinders, then these problems are bound to arise. It is a great idea to overcome that problem. We have created an oxygen generation plant here. In simple words, it is a kind of oxygen concentrator, only with greater capacity.
Oxygen concentrators continue to arrive along with other international aid. Trains are being used to transport cryogenic tankers with liquid oxygen to those states hardest hit by the virus. The government has expanded the vaccination program to include everyone above the age of 18, but there are shortages of doses too. People have been waiting in a line outside this centre for hours. The vaccines arrived late and the process is taking much longer than expected. And that's only leading to more frustration for people standing in queues where proper social distancing isn't possible. GLADWIN Rawat, like hundreds of others, waited for more than 3 hours for his jab.
I feel the delay in the center is the main issue because people have been waiting here since morning. They were told that the slot will open up at 10 o'clock, but they have been here like 8 o'clock, 9 o'clock. And now we are getting, our turn to finally get in.
In some sites, vaccinations were delayed because of a lack of healthcare workers to administer them. To ease the pressure on the healthcare system, India's Supreme Court has asked the government to consider imposing a nationwide lockdown, but not before making arrangements for India's hundreds of millions of daily wage earners who must work every day to survive. Elizabeth Puranam, Al Jazeera, New Delhi.